Perfect. Any questions based on last class? Is everybody comfortable? I've graded 7 people submitted the answers to the question week 3 questions. There was not confusion, but a definitional issue. The traditional definition of malnutrition is undernutrition, but if you actually go to the World Health Organization, they include obesity and adiposity within the spectrum of malnutrition. But they also clearly state that obesity is a much bigger problem, like 4 times the problem of underweight and low nutrition. So the answer is still the same. And I don't mean to minimize, hunger and famine and, kwashiorkor and all the diseases associated with vitamin deficiencies and calorie deficiencies. It's not as big a problem as adiposity. So, but, equally devastating in terms of its impact. And tragic because a lot of times it affects kids under the age of 5. So really beyond description. Anybody have any other questions about the answers to the week 3 questions or clarifications or anything? I'm trying to think if there's anything else that people. No, I think that was about the only thing, was the discussion of whether malnutrition includes adiposity. So again, if you go to the Oxford Dictionary, the answer is no. If you go to the World Health Organization, they include it as a subcategory, so that's fine. And for people who had the question, I actually put in 2 references. One is to the World Health Organization in terms of their description of the numbers worldwide. So that's great. Beyond that, today, after we go through and what I'd like moving forward is that every time we have a class and you talk about your topic, you talk about something you read and a fun fact, meaning something you learned in the thing that you read that, added to your knowledge base. Because I'm sure if it added to your knowledge base, it'll add to all our knowledge bases with regard to the topic that you're researching. And that's, again, just to make sure that, you're holding your feet a little bit to the fire in terms of looking at least 2 references a week. And again, you have at least 5 hours a week to work on the paper. So I don't think it's much to ask to say, give us a reference and a fun fact. Well, it looks like we've got everybody on the call, so that's great. If everybody could turn on their cameras, that would be great too, just so I can make sure I'm, when I crack a joke, you smile, I get some positive feedback. That's always a positive, good thing. So today, after you guys go around the, let me put up the participant list, just so I can, even though it moves as it changes over time. So I never am quite sure who I've called on, but I'll just say next, or if you haven't spoken. Okay, perfect. So we're going to go through that. And if we get done quicker, that just means we can spend more time on 2 topics. One is gun control. And the other one that I have to just bring up, just because it's so salient, is police violence. I'm just sick to my stomach over what's been happening. And I don't know if you guys saw the most recent, just beyond belief, video from California of a double amputee who the police shot and killed. It's all videotaped, or at least the period just before the shooting. And the guy, again, double amputee, his legs, he was kind of trying to get away, had a wheelchair but didn't use it, and was trying to walk / get away on his stumps. And he had a knife. Has anybody heard or seen this? You have to hear. Did anybody hear what the justification of the police was in shooting this guy? You're not going to believe it if I tell you. Has anybody heard what they said was the justification for shooting him? Again, double amputee, and he's carrying a knife. Big knife, no argument there. But how much of a threat with somebody who's a double amputee, even if he's carrying a knife? They were afraid he would throw the knife at them. That was the justification for killing this man. So raise your hand if you think police violence is a public health problem. So we have a clear majority that think it's a public health problem, and we'll briefly talk. Maybe we'll talk about that first after we go through the papers, just to sort of say what are your thoughts on what to do about it? What are the options for correcting the problem? And whether is it a policing problem? Is it an education problem? Is it a societal problem? Is it a racist problem? Since it overwhelmingly disproportionately involves the minorities and the resource poor. So why don't we just go around the room? I'm trying to think of how I could do this.
Professor Nick.
Yeah.
Kelsey said that her computer isn't letting her like put her mic on her camera. There's something happening with this. She's having technical difficulties, but she's still here.
Okay, well, that's fine.
Yeah, she shot me a text. So
oh, that's cool. That's great. Yeah, yeah. And the other thing is too, honestly, I never monitor the chat function as much as I should. I'm trying to find the chat function.
She didn't. I don't think she said anything. She just like messaged my phone real quick.
Okay, that's fine. Yeah, she can boot or reboot or do whatever's necessary so she can participate. That's fine. And I appreciate her speaking up. That's great. Meaning to notify me that she's there, because I did ask people to turn on their cameras and hers didn't turn on. So that's all good. Well, I'm just going to go based on the list I have and start with Sydney in terms of an interesting paper and fact. And if there's a topic beyond the two that we're going to talk about in Kaiser Health News, feel free to share.
Okay, so I found one, and it kind of just talks about like how often patients ask for like physician-assisted suicide. And so it's just like kind of a case study where they ask physicians how many times they have been asked by patients. And so it's just like interesting to see all the numbers. And in the past year, 12% of the physicians had been like asked.
Yeah, so if you actually look at it, do you think a majority of people favor it or favor sort of either physician-assisted suicide or some facilitation of ending death if they're in a if that's their wish?
They're kind of, I don't know, they're like good about showing both sides, but it does seem to be more like they are for it because they're trying to show like the point of view from the patient and how like they want it, not that it's like anyone else's choice.
Yeah, no, and I mean, again, I don't, some people think that, they should impose their will on another person's desire to not suffer. But reasonable minds would disagree on it. But when surveyed and when looked at, over half the people, and I think there's 15, you'll be able to educate me, Sydney, in the class. I think there's 15 or 17 states now where it's allowed. So, and there are many countries where it's been allowed for many, many years, with varying requirements and varying, hoops that you have to jump through to qualify for it. But I think there are 15 or 17 states currently that allow it. So, just like the slow legalization of marijuana, for the long time it was reefer madness and everybody was opposed to it. And then there's been a slow migration toward the medical use of marijuana and now and increasingly the recreational use of marijuana. So, public opinion, it changes on that topic. So it is interesting. And any other topics that on Kaiser Health News, or you happy with gun control and police violence?
Yeah, no, I was looking at that and then I just looked, there's always like reproductive rights being updated.
Every day they're going on. And we've got some people working on that. And I mean, there's going to be, years and years of sort of discussions of Dobbs and the overruling of Roe v. Wade in terms of the implications and what's going to happen. And, the Supreme Court has actually already said, because some states have said they're going to prosecute people who go to another state, who then take advantage of that state's more lenient rules with regard to protecting their reproductive freedom. And the Supreme Court, I'm trying to remember who it was, I think maybe Brett Kavanaugh, said that is unsettled law and I cannot imagine it will be upheld. I think we briefly that you can prosecute somebody, because I think I briefly mentioned to you guys, you go to to New Hampshire, you buy an automatic weapon, you don't have any of the requirements, and you live in Massachusetts, and you don't fulfill any of the requirements for owning that firearm in Massachusetts, you leave it in storage in New Hampshire for your use. It seems to me there's just absolutely no grounds that Massachusetts could prosecute you, because you don't have the firearm and you didn't engage in illegal activity in the state that you were in. So, and the same applies, I think, to reproductive rights. So I can't imagine, even with the insanely conservative Supreme Court we now have, that they would permit that type of prosecution. So yeah, it's a great point to bring up. Okay, great. Oh gosh, all these things are. Okay, so why don't we just go, I'm just going on the list I have in front of me. And if I call on you twice or you haven't spoken, just please speak up, because again, the list on the participants changes. I've got Olivia next.
Okay, so I was looking at the Tyree Nichols case, which was like another like police violence one. It was in Memphis, so he was stopped at a traffic light, and police came and they started like beating him, and in the initial police report it said that like Tyree had initiated the fight. He had tried to grab one of the police officers' guns and everything, but then when they went back and looked at the police footage, like all of the stuff that in the initial police report that the police officers had said had happened had not actually happened. So they basically like beat this man to death for no reason.
Yeah, the video is just cruel to watch.
Yeah.
I mean, it was like, you know, he started calling for his mom and lived for about 3 days, intubated in the ICU, and then finally passed away. His funeral was yesterday. Kamala Harris spoke there.
Yeah.
Trying to remember the guy the civil rights leader who gave the eulogy. But I mean, this is a problem, and I'm looking forward to everybody sort of chipping in to say what they think needs to be done about it, what they think the source of the problem is, and what's the preventative measure. Since this is preventative public health, let's talk about it in that light. And then on your paper.
Yeah, so I'm doing prevention and early intervention for autism in adolescents. So I've been looking at some like screening strategies that can be implemented for like all children across the board. So they aren't diagnosing so late, and they can start intervention early so that child can be basically more successful later on in life.
That's great. Have you read any articles that were of interest to you? And let me just suggest to you that, as you've already stated, that adolescence is too late. So I would just change the title to early screening, preventative measures for early screening of autism to prevent delays in diagnosis. Because frankly, most of the data that I'm aware of, but you're going to be the expert on this by the end of the class, is that early intervention does seem to have a beneficial effect, but early is like 2, 3, 4, and there's a lot of neurodevelopmental testing, which you're going to end up becoming an expert in. But I think there's also sort of classroom, teacher, parental, screening that can happen. So yeah, I think it's a great topic, and frankly, if we, the earlier we can intervene, the better. And of course, autism is this gigantic spectrum of disease, from profoundly autistic, where no language skills and no self-care ability, kind of trapped in a 3-year-old body for a lifetime, versus Asperger's, where they're super high functioning, where intervention is helpful but not life-saving because the people are high functioning. So it's a really interesting problem, and maybe you will focus, just to make your own life easier, screening for the highest level of disability. So again, to intervene as early as possible. So that's great stuff. I appreciate it. Good work. Gosh, here we go again. Monica.
Yeah, so for the news, it's about shooting as well. I mean, it's something we've been talking about, The new gun deaths data show that there is continued rise in suicide. And I didn't know like the percentage of gun deaths that are suicide. Apparently it's 54%.
A lot of people quote even higher numbers, like 65% or 70%. So yeah, but that range is absolutely correct, 50 to 70%. And I've actually written a blog on this saying that we don't have a gun problem, we have a suicide problem, and that we would solve, 2/3 of the gun deaths by more aggressively screening for people who are depressed or suicidal. It's not an easy solution because the fact is, I'll ask a question and we can do the hand raising technique. What percentage of people who commit suicide have no history of mental illness? So I'll go 10, 20, 30, 40. You raise your hand when you think it's the right answer. So have people who commit suicide, what percentage have no previous diagnosis of either depression or suicidal ideation or problem? So 10%, 20%, 30%, 40%, 50%, 60%. So you guys go along with my gut feeling before I learned the answer was that they must have some inkling of either depression or bipolar or previous psychiatric history. It actually turns out to tragically be 60% of people. Their first foray into a behavioral health problem is blowing their brains out, which is, and again, part of the solution is clearly taking a highly lethal form of suicide, guns and handguns in particular, and making it unavailable to them. Yeah.
Yeah, so yesterday from one of the videos or readings that you assigned, I think, they were saying, or maybe it was something else, I read it somewhere else, 90% of people who try to commit suicide and who fail in committing suicide, they don't try it again, like 90% of people.
And if you ask them after the fact, it's over 90% that say, I'm so glad I was unsuccessful.
Yeah, so like if it's gone, then you are probably, that person is probably going to die, most probably going to die if they shoot themselves. So that's why I think gun violence, like restricting guns would definitely reduce suicide and homicide by a lot of numbers.
Oh yeah, yeah. I don't think anybody argues with that. Again, the number of, for instance, though, what do you make the law? And there's a lot of red flag laws. We'll talk about it when we get into class after we get through the papers. But it's a really interesting topic in terms of where is the low hanging fruit in terms of minimizing deaths and long-term disability and injuries associated with guns. And so we'll talk about the readings as well. So that's absolutely on point. Where are we going there? Oh, did whoever spoke last, did you go over what fact or paper you with an interesting fact that you got?
Oh no, I haven't. So
okay, please do.
I'm trying to understand, like I know the US healthcare system by now, but I'm trying to understand the healthcare system in Switzerland. And I read some articles. And then one very interesting thing that I found, it's the article that you sent me actually. So in the United States, there are only like 1/10 of the citizens of the people, Americans, are capable of buying health insurance on their own, and rest of the people, they rely on their employees. However, in Switzerland, they are trying to prevent its citizens from incurring more than 10% of their earnings on insurance. So no more than 10% of their income should be is spent on healthcare, which is
otherwise the government subsidizes it. Right?
Yeah.
Yes. No, I mean, that's just the right thing to do. I mean, people should not be unable to get healthcare. I mean, it's just, I mean, most people agree it's a fundamental human right, but not in the United States. So I'm going to ask this question because it's so bizarre. So in the Constitution, is there a right to
No.
Is there a right to healthcare? No. So that's correct. So what is there a right to in the Constitution that the government has to provide to you as a matter of the Constitution? You guys are, I think, maybe a little bit shocked by this. Hopefully it'll shock you a little bit. And can anybody think of anything? And I'll tell you, it's in the Bill of Rights. what is guaranteed, meaning an affirmative right that the government has to pay for you to do. So we know freedom of speech, but that's a freedom from, it's a negative right. It's a freedom from having your speech compromised. But the government's not going to pay for you to go on TV or to have a social media account or to buy a soapbox and a stage for you to exercise your free speech. So and same thing with guns, same thing with religion. Those are nothing. The government's not going to pay for your church to be built. The government's not going to buy your gun. So those are all negative. They're prescriptive rights. What is the one mandated right in the Bill of Rights that the government has to pay for? I'll give you another hint if nobody knows. What does Miranda say? So when you're Mirandized, which is they read you your rights when you're being arrested, what is included in that the government will pay for?
A defense attorney?
That's the only thing in the US Constitution that the government will pay for. So will the government pay your water bill? Will they pay for food? Will they pay for housing? None of it, but they will pay for your attorney. So the only, and of course, there's multiple international, treatises and organizations that have described basic human rights, and all those things like clean water and housing and a job and a million different things are all thought to be, basic human rights, but not in this country. The only thing, meaning affirmative rights, the only thing that the government is obligated to do is to hire your attorney. Maybe makes you think that maybe the attorneys had something to do with how the Constitution was written, since they only guaranteed themselves a job, but not food or shelter or clean water. So anyway, it's pretty shocking. So yeah. So and again, one of the things I ask you to hear is that if I see topics, if you're having trouble and you want for me to help guide or steer you in a particular direction with your topic, I'm happy to spend 5 minutes sort of doing a quick literature search and Google and give you some ideas about where to go. So this comparative stuff is cool, and Switzerland is cool, and it's used as a very frequent model for providing healthcare and financing healthcare. So it's all good stuff. Okay, and again, my list of participants just keeps flipping, so I'm going to go with, and again, I apologize if I've already called you Megan.
Yeah, so talking about gun violence and everything, yesterday there was actually a shooting at the Metro in DC, two stops away from the Capitol. The guy killed one person who worked for the Metro and injured 3 other people.
The guy was trying to actually stop him.
Yeah.
Who was killed, which is really sad. Talk about a hero.
Mm-hmm. So that's what I found for that. And then for my topic, I'm doing postpartum psychosis. Mm-hmm. And so it's actually more common than most people think. It's about 2.6 births out of every 1,000 births, which doesn't seem like a lot, but it is. Like, if you think about like how many that happens globally, that's about like 12 million births that result in postpartum psychosis for the mothers.
And postpartum depression is infinitely higher. It's just that the vast majority of those are either subclinical or don't require any intervention.
Yeah, and recently there was a mother in Massachusetts who had postpartum psychosis, and she ended up killing, I think, her 3 children and herself.
Right.
Because there's lack of awareness and treatment options for mothers with postpartum psychosis.
Truly tragic. One of the things with regard to your comment about the shooting in Washington, D.C. subway or metro, was that I just read an article this morning. I think it was in the New York Times, but they're rethinking the I go through a ton of medical literature every morning, Kaiser Health News, and then a bunch of, standard New York Times type stuff. But one of the things that they said is they're rethinking the run, hide, attack philosophy in mass shootings. And they're really thinking of suggesting that the attack might say attacking first rather than running and hiding. I mean, running makes sense, but hiding doesn't. If he or she finds you, it's overwhelmingly he's. You end up dying. But the attack aspect of it is like people, if 3 or 4 people throw themselves at the attacker and disarm the attacker, it may end up saving lives. So they're rethinking that whole strategy, which again is a sad statement. But there's been honestly, there's been a lot of recommendations, including arming teachers who don't mind getting trained in guns and firearms, having them available in these rare events. I mean, the problem is, creating policy like that for, every 10,000 guns that go out to schools and teachers, literally, maybe 1 or 2 in a lifetime will get used. These are extremely rare events, and you don't want to create policy for you don't want to say you should wear a shark suit every time you go into the ocean, since so few people die of shark attacks. So you want policy to be based on reasonable and likely events. Maddie.
My topic was not on like gun violence and stuff. It was on in rural areas, nursing homes are closing because they don't have like the staffing, which I thought was I mean, with everything going on in today's world, sorry.
No worries. Yeah, no, was there an article you read or fact you read about
It was on Kaiser.
Oh, it was on Kaiser. Okay.
Yeah,
So that's
think-
not your topic, or that is your
No,
topic?
that was not my topic.
Okay, fine. Yeah, I didn't remember that topic. So I'm saying, yeah, no, there are constant articles in Kaiser, both about nursing homes closing and rural hospitals. So rural nursing homes and rural hospitals. What's your gut feeling about it, just for 30 seconds?
I mean, people aren't going to not get sick, like they are going to get older, and it's sad that like we don't have the almost support anymore that we used to have to take care of like all the sicker people. But
so the closing of rural hospitals, this is a topic that I've sort of spent a little bit of time thinking about. How should we distribute hospitals? Should they be done on a per capita basis? Should they be done on a geographic basis? There's tons of tiny hospitals that basically have like less than 50 beds, maybe 1 or 2 ICU beds. They constantly lose money. They can't find people to staff them. Are there cheaper ways to solve the problem?
I mean, speaking from somewhere that only has a hospital that has 25 beds, we usually get the med flight to come down and send us to Cape Cod. But
Are you on one of the islands?
Yeah, I'm on Nantucket.
Oh, cool. I used to work there.
Yeah.
Yeah. No, Cottage Hospital, isn't that what it's called?
Yeah, they just merged with Massachusetts Brigham or
Mass General Brigham. Yeah, no, they were bought out. The Brigham first bought out Martha's Vineyard, and then they bought out. But yeah, I mean, the easier solution, rather than trying to run a hospital with 25 beds, is move the people. I mean, it's just not. And think about, what do you think of the quality of care? And I've worked there, so you can say anything you want. What do you think of the quality of care at like a college hospital or Martha's Vineyard? And I'm trying to remember what the name of the Martha's Vineyard hospital is, and I can't remember.
I have no idea.
I have no idea either.
I mean, I personally haven't gotten like the greatest care. Because
is that surprising? I mean, do you think?
No.
Yeah, no, it's not surprising at all. And so again, I think we need to have a more balanced approach. I mean, you hear all these people decrying community hospitals closing, and my attitude is, yes, great, that's terrific. If you can't make a profit, if you're so small that likely the quality of care you're going to be giving is not up to snuff of a larger place. And there are literally myriad studies indicating that the volume of service you provide and especially like in surgical care is directly correlated with quality. So the more you do something, the better you tend to be at it. So yeah, no, I think that's I think that's an interesting problem, and one that we're going to have to wrestle with as time goes on. But I mean, it's just so much easier to invest in great transportation of patients to high quality centers than it is to maintain tiny little hospitals that are failing. So, and I don't know how anybody, by the way, lives on Nantucket, since even the cheapest home is over $1 million. So,
Well, a little cottage that's like 0.05, I think it sold for 1.4 million the other day.
so I can't imagine the island will be occupied by anybody but billionaires if
Yeah.
in the summer.
Well, and that's why we can't have like good doctors, because there's nowhere to put them. If you don't have anywhere to live, they don't stay. And so we can't get the good, like I think we're 16 teachers short in all of the public schools because there's just no housing. And it's like, it's hurting the kids growing up as well that don't get an education.
My understanding is that the only way you can get help there is if you include housing, like during the summer when it's really busy. It's a beautiful island, by the way. But when it's really busy, the only way you can recruit anybody is to provide housing for them, because there's nothing affordable or able. So I don't know how the island itself is going to deal with that problem, but it's really going to blow up. And that's a sort of island-wide societal problem, not just a health issue with the hospital. So, and the nice thing is I was a radiologist, so I had the ability to literally just take all the x-rays and then ship them anywhere that I wanted to get them read. So it was not as big a deal for me, but we still did some occasional fluoroscopy work, which is, upper GI, barium swallows, barium enemas. So, but even that, to me, get on the ferry, and none of those are emergency procedures. Get on the ferry and get it done, in Cape Cod or any other hospital that's reasonably accessible.
Yeah.
So that totally makes sense.
Well,
And
they usually send you off as soon as you go in, because they're like, yeah, we can't deal with you.
well, you know what? That's a good decision, and I mean, the issue is, should basically every doctor, or should there be just telemedicine? And when the time comes through telemedicine that everybody who's told this cannot be dealt with via telemedicine, go to this urgent care center and they will airlift you to the appropriate facility. So, you start having chest pain, you need to go somewhere emergently, and that emergent place should have the ability to mobilize a helicopter to come out and get you to a hospital that can take care of you, or a stroke. So interesting. And your paper topic?
PFAS in cookware. And
have you found any articles, or did you learn anything of interest on the topic?
There's a lot more like companies than I was expecting to have, like nonstick pots that have PFAS, but like there's always like an alternative that for a fact will not have PFAS in it, and that's stainless steel.
So that's interesting. Yeah, I know nothing about the topic. I'd be curious, are you in your early research, and again, you've got weeks and weeks to drill down on this, have you heard of other countries eliminating it in cookware? Are there other countries that do that? And if you don't know the answer, that's fine. But I think, at least for me, that would be an interesting question.
Yeah, nothing. I think all of this stuff, just quickly looking, is all in the States, but it would be interesting to see what other countries are doing.
Yeah, no, it's just, answer the question just because it's my interest. And frankly, I can Google it myself if you don't come across it. But anyway, I think that's good. Okay, great. Again, these things keep moving, so it's hard for me to know if I've called on you. Kylie, have we talked already or no?
We have not.
Okay, go for it.
For Kaiser, I was gonna start with Kaiser real quick. I read that the Merck COVID drug was linked to new virus mutations.
Yeah.
So I thought that was interesting.
Yeah, that was this morning. So that was totally interesting. I'm thinking, geez, the cure could end up being worse than the disease.
Yeah, I thought it was pretty scary.
Yeah, no, I mean, it happens all the time that a solution is proposed, and then, I mean, the classic example of this, has anybody ever heard of thalidomide? So thalidomide was a drug, a few people have heard of it. I'll just give you the quickie on it, but there's a million thalidomides out there. It was a drug that was supposed to prevent nausea in pregnancy. And so they gave the drug, and it passed all the preliminary assessments, and the FDA approved it, and it went out. But, they tested it on whatever, 5,000, 10,000 women. When it started going out, because again, nausea and vomiting associated with the first trimester pregnancy is just enormously frequent. It turns out thalidomide causes extremity deformities. And literally tons of kids were born with no arms or no legs. And they only realized it after millions of people. And this happens all the time with drugs. They do the studies, the FDA approves it, and that's why the FDA says we're very delayed in approving it. Almost always drugs are approved much earlier in Europe than they are in the United States. But even with the viruses, there were a ton of virus experts with regard to vaccination for COVID that said, wait till the first 3 million people get the vaccination before you have yours. So you'll have a gigantic group of people who've had it, and you'll at least know that within the first 3 to 6 months, there are no known gigantic dilemmas associated with the vaccine. And again, the verdict is not out on whether the vaccine will have any adverse effects 5 or 10 or 15 years down the road. I've been jabbed 5 times, so I just keep my fingers crossed. So that's really interesting, and it's a very frequent problem. I mean, the 2 drugs that have been recently approved for dementia treatment are completely suspect. If you look at the data on them, they are of marginal benefit and have really significant side effects. So always ask the question whether the cure is worse than the disease. And your topic?
I'm still looking into the funding for children's health insurance. So I looked at that CHIP article from Health Affairs you sent me, and CHIP is the only like public insurance program that does not have permanent funding. I thought that was like a fun fact. So
I think it's great, and I'd love to know, what are the means of creating permanent funding. I mean, it's always a money issue, but I think it's an interesting topic. So yeah, and once again, you're hearing a couple of students saying, "Oh, the article you sent me, I'm happy to send everybody articles." Just to make your jobs easier. So again, I'm not writing the paper for you, and I'm not going to steer you in a particular direction, but just sort of based on my background and experience, sometimes certain articles appear to be of much greater value than others, and may steer you. The nice thing about getting an article or two is that the reference list at the end of the article is just an infinite resource for new information. So I always try to get a very current article, 22 or 21, if not 23. And then look at the reference list and then work my way backwards to pick out those references. And I'm sure your library can get access to all these different journals, so it's not a problem. So that's great. So I'm going to get to the point where well, you know what? Anybody who hasn't spoken can speak, so I don't embarrass myself by calling on people twice. Because again, my list just rotates.
I'll go.
Great.
So for Kaiser, I found that GoodRx got fined for oversharing their user health data with big tech. And I kind of was just thinking about how like it kind of supports like that sick care model, and it also like supports the claim that like the health industry is motivated by money, because like we know that like Google and Facebook sell their user profiles for marketing, but like to see health companies and big pharma doing that, it's not surprising, but it's also really scary. Just because you don't know, like you consent to some things getting put out there, you probably sign the fine print at the end of like apps and stuff when you sign up for them, but like you really don't know what the people are doing with that information. And the fact that it can possibly like promote you staying on drugs or staying on medications that might do harm is kind of scary.
Yeah, it's actually even more nefarious. Why do you think people want you to sign up for all these apps? Why do you, I mean, Walmart wants you to sign up for their app. McDonald's wants you to sign up for their app. Dunkin' Donuts wants you. Why do you think that's the case?
Well, pretty much like what they do is when you sign up for these programs, they want you to spend money in their organization so then they can get money and they'll reward you for spending money within like downloading the app and all that stuff.
So it's absolutely true. They have frequent flyer programs and bonuses and coupons and stuff. But what's much more valuable than all that, even though they do get increased business oftentimes, what's much more value and that you'll see very frequently when you open these apps, like McDonald's is a classic one, because I don't go there. I buy a coffee for $1 on their discount menu once every 3 or 4 months. What do they do though when I open their app?
They don't they collect information
Oh,
on based on,
man,
and then
it's
they sell it to other companies. So they're selling information about you.
so GoodRx, they would just as soon know where you're traveling, whose parking lot you're in. I mean, all that data is hugely, hugely valuable, and they'll sell it without a second thought. And you're just thinking, look, I just want to get a hot cup of coffee, or I just want to get, a double cheeseburger, and they're just tracking you everywhere you go. Which is exactly what happens if you look at your phone. You'll see there's a tracking little one of those green things. As long as the app's open, they're tracking where you are. So yeah, so in the old days, and I think I mentioned this before, sorry if I repeat a few things a few times, but I repeat them probably only because I'm demented myself, and because there are important pearls to be learned out there. But in the old days, it was fossil fuels and oil that were, coal and natural gas that were the most valuable resource. But nowadays, the most valuable resource in the entire world is data. So just be painfully aware of that, because, some people say, and I definitely don't mind it, if I'm looking for a product and they're tracking my search engines, and so then I see an ad for a product that I'm interested in, sometimes that's actually beneficial. But when you sort of think about the fact that you're being tracked and followed literally in everything you do, but there is no privacy in the world. I mean, just between all the video cameras that are out in every public space you're in, every store you're in, there is no real privacy anymore. I mean, the only place there may be privacy is in your home, but even that's gone. I mean, how many homes now have smart speakers? And I don't know the exact answer for this, but huge number of people have Siris and the like. And then and Alexas. And then, how private is your phone? Is your phone listening at all times? Yeah, it's waiting to hear you say, "Hey Siri." There it is. It heard it. So I don't know if you heard that. Is there something else I can help with? Yes, you're probably going to find some product that I want to buy and send me an ad about it. So the reality is, and again, there's benefits and there's harms. The harms are you're literally being surveilled constantly. Your phone, your Alexa can hear everything you're saying and monitor it. But can anybody think of a health benefit of something that's monitoring you constantly in terms of listening?
Well, with Apple now, with the new iPhones, they're able to monitor now if you've gotten into a car accident and something's happened, and they'll automatically call 911 to come and rescue.
Yeah, no, I mean, is that valuable? That's invaluable. I mean, how about screening for disease? If it's notices that you're sneezing more or that you're coughing more, and saying, I've noticed your frequency of coughing is increased. Have you taken your temperature? That would be useful information. I mean, it's intrusive, but it's useful information. Anyway, that's that. Again, everything's a two-edged sword, so that's cool. I'll ask you to just keep going if you haven't spoken. I think we have 4 more people.
Yeah, from Kaiser, I found this article about public schools have been having a big funding cliff with students who are suffering from mental health, and especially during COVID, and they're trying to confront that dilemma of mental health and trying to support their students.
Yeah, we're just so underfunded, and we have no resources available for behavioral health issues. It's a national tragedy, and it's such a common problem. 30 to 40% of the population at some point will have a major behavioral health diagnosis. So
yeah.
I don't know, we can't pay for getting people in to get their appendix out. Forget depression or other problems. And your paper?
So from the article story that you sent me from a few days ago, I was reading into that, and there was just some facts that I thought was super interesting. It said that for neurosurgery, it's one of the top 3 specialty surgeries to be the most triggering claim. And it's skyrocketed by 23%, that there's always some sort of injury that occurs during surgery. Like no matter if you're doing like spinal surgery or brain surgery, that there's always like some sort of injury to it.
Yeah, the more you research how often injuries occur, that just you will never go see a doctor or go to a hospital again.
Yeah, it's kind of terrifying after
Oh my
doing all
God.
this research.
Oh, it's you'll never go to a hospital again.
Yeah,
I
you
remember
won't catch
when
me at the hospital again.
yeah, no, I mean, I tell people to avoid doctors at all costs. I mean, that there is as much good as harm done, and depending on what your situation is, oftentimes much more harm done. But I'll never forget when I had my second surgery, I was sort of just being very aware of when things were done incorrectly to me. And I must have counted during my 2-day admission for my second surgery on my spine, probably 50 different things that nurses did wrong that were, I mean, I had to prevent DVT, I had these inflatable devices to compress my calves, and I would get up to use the restroom, and so I had to take those off, or the nurse would help me take them off. I'd use the restroom, and then they would never put them back on again. I mean, there were just countless things, missing vital signs. The list just went on and on and on and on. I mean, I always tell people, if you have somebody who's in the healthcare industry and you have to go to the hospital, have them literally stay in the same room with you, because that's how dangerous hospitals are.
Yeah, I'm like normally a nut person when it comes to like the hospital, especially since with me working in healthcare too. And like I try to voice my opinion about it, and they're like, "You're a kid, how do you know this?" I'm like, actually, I'm certified for 5 years, so I do know what I'm doing. But it's not like they're ever gonna like listen to me because
Yeah,
they
no. The minute you speak up, you're just viewed as a troublemaker, and when are we to get this person out of here? Which to me is a good thing. I'm ready to get out. I discharged myself early from both my hospitalizations. It's just for healthy people, hospitals are a very dangerous place to be. There's falls, there's hospital-based infections, there's just a million things that can go wrong. And there was actually a study done where they tried to figure out if you were a very low risk for MI, but they admitted you for 24 hours myocardial infarction. Sorry, I use all the lingo, and I assume you all know but myocardial infarction just means heart attack. So you rule out MI means you come in with atypical chest pain, your EKG is normal, they've sent off some labs to see if there's any cardiac enzyme abnormalities, to see if you did indeed have a cardiac event. Overwhelmingly, those turn out to be negative. But a small percentage are positive. But they did an analysis to determine if in very low risk rule out MI, if it was safer to stay home. And there was in very low risk MI cases, they said you were more likely to die of an iatrogenic injury than, meaning doctor caused or hospital caused, than you were to die of a missed myocardial infarction. So they said, send everybody home. I thought that was just a staggering study.
Yeah, that's crazy.
Yeah, but there's plenty of it out there. And the more you study safety and quality, the more you're just going to be sitting there gulping and gulping and gulping.
Yeah, I'm gonna be like that crazy Karen at the hospital with
Oh,
spitting all my facts from my paper.
no,
They're gonna think I'm crazy.
yeah, no, it's absolutely the case. And but anyway, my advice always is, when it comes to healthcare, always get second opinions, because you never know whether what you're getting is the straight and skinny. And if you have to be hospitalized, it's always great to have a friend or somebody with healthcare background to be there as an advocate for you. So that's great.
Yeah.
Okay, I think we have like 2 or 3 more.
So for Kaiser, I found one that kind of related to my capstone, how your child's academic success may start with their screen time as infants. I just thought it was
Very hot topic, especially with the American Academy of Pediatrics.
it was basically like kids under 18 months shouldn't have any screen time at all, and it kind of like delays their social skills because they see the screen as, I think it was saying, like 2-dimensional, and they need that interaction of person to person, like parent to child, but they can't perceive that at such a young age.
That's an interesting statement, because so many kids are like plopped in front of a mobile or mobile or whatever they're called, the things that float over a baby's crib and just kind of move around and stuff. And that's supposed to be healthy in terms of creating visual stimulation. So I'm sure there's high quality screen time and there's low quality screen time. And unfortunately, you get cable TV and you have 172 channels, of which 170 are worthless. So I bet they could narrow it down where the visual stimulation for infants for specific screens might be better. But again, I know nothing about it, but it's an interesting topic. And then in terms of your paper?
For my paper with the baby formula shortage, I found that,
I thought I sent you something too on that.
yeah,
Good. Yeah, no, I remember seeing that and I'm thinking, oh, that's cool. Yeah, the FDA just hired a person to direct that specific topic of foods and food safety, critical foods.
mhm. Really kind of an interesting fact that I found was before like the 1900s, when women were able to like breastfeed and they didn't have like formula, they would hire like a wet nurse to breastfeed their infant, and if they couldn't do that, then they would like actually have their kid, I don't know, eat from like a goat or a cow or a donkey.
Oh, cool. Never heard of that. Sounds a little weird, but whatever it takes to feed your kid.
Mhm.
So yeah, no, I'm looking forward to the topic and what solutions are out there for, critical foodstuffs. And especially I think probably critical food stuff like allergy preventing foods. Like, so if you're gluten insensitive or then, it would be interesting to see how we deal with that if there's only one or two major providers. Obviously, the real solution with baby formula is that you don't have just 3 companies that do it. You have 15. So if any 1 or 2 go down, the rest are okay. So yeah, interesting topic. Who's left?
I can go.
Okay, great.
So on Kaiser, I thought it was really interesting. Like, so I saw that article about, I think it was 20 state attorney generals sending letters to like major pharmacy companies like CVS and Walgreens to ensure that they weren't going to be sending out, abortion pills through the mail, blocking that access. And then for my paper, I was looking at, I'm doing how is like IVF affected in states where abortion is illegal now. And so I was looking at a couple different opinion articles, because right now a lot of this is speculation. But one that I found was talking about how Louisiana is working on a personhood law that would protect embryos essentially like from disposal. But so they were talking about like what that could mean. And it was saying, if say a couple of parents are successful with a round of IVF and they don't want to like continue further treatments, they're happy with their one child, they might have to legally turn any leftover embryos over to the clinic to be, given in that case.
So
And
I'm just curious, who's going to pay for the storage of the?
and that's I don't know. And that's where I'm like coming across blocks, is how are they going to enforce these things? Who's going to be responsible for the cost? And then I wonder, of course, patients can go to different states to, pursue IVF, and that's a huge financial expense. But are they also going to maybe withdraw fewer eggs at a time and do like fewer embryos to ensure that they don't end up
So there's definitely other countries that limit the number of oocytes that you can retrieve and the number of embryos that can be fertilized. So it'll be interesting to see how other countries have dealt with it. But there are definitely countries that say you can only fertilize 3 of them. And then once those are fertilized, those are the ones you implant. And obviously, you don't want to implant 1 because your chances of getting pregnant are much lower, and you don't want to implant 6 because it's hugely dangerous to have triplets and quadruplets and the like. And one of the problems with Dobbs and the reversal of Roe v. Wade is that when IVF would lead to quintuplets or quadruplets, they would do selective reduction because it's so dangerous to the mother. I mean, forget the trauma of it, because these are people who are trying to get pregnant, and so they're now being told we need to selectively reduce your pregnancies. But it's hugely dangerous, both in terms of the survival of the kids and the survival of the mom. So it's really an interesting problem, and we'll follow with interest in terms of what you find moving forward. I think we have one or two left. Who hasn't spoken?
I haven't yet. I might be the last one too.
I'm sorry?
I think I'm the last one.
Oh, great, terrific. So we'll take a break after you, Jack.
All right. On Kaiser, I looked at the article about nursing homes. They were getting a ton of funding, but nothing really changed. And if anything, they kind of were deteriorating more, and patients were seeing worse care.
Oh yeah, no,
during the pandemic.
Yeah, the nursing. Well, one of the interesting facts that I read in the past year and a half was what percentage, and we'll do the hand raising thing. What percentage of nursing home workers were not vaccinated? 10%, 20%, 30%, 40%, 50%. So you guys know the answer. It's 40%. In hospitals, what were they doing when you didn't get vaccinated? Firing. Yeah.
They were
Bye.
firing people. And even at my facility too, like they were firing people who weren't getting vaccinated.
I mean, put it this way, raise your hand if you would go to a hospital where the healthcare workers were not vaccinated. Yeah, I'm not going to a hospital where I could get the disease that I'm supposed to be protecting myself from in the ER, from the ER nurses or other workers there. So, I mean, and the courts backed that up. They said healthcare facilities can mandate it. So pretty much anybody who works in a hospital has to get influenza, or in most of it's either you have to get the vaccinations or you have to wear a mask in the hospital. And I think that certainly is not imprudent. I mean, it certainly makes sense. And any articles that you saw or fun facts from your preliminary research on your paper?
I looked into SAMHSA, and I was looking at a couple things they do. They had a portal like specifically for first responders, and then they also made like an education pamphlet that they give out to people who like aren't willing to like make the step themselves. They'll give out like prevention pamphlets too.
Yeah, that's great. I mean, I'd love to know what best practices are in terms of policies and procedures, which you mentioned last week. Yeah. And I'd love to know, so you can promulgate those and get those out. But the other thing is these connection workers / community health workers, how you get people connected to the right resources, and it doesn't have to be a hospital or a psychiatrist. It might be 12-step, it might be a church, it might be a support group. Those I think are all really important things, and they don't cost a lot of money, but they can save a lot of heartache and disease and death. So yeah, that's wonderful. So it's 1 o'clock. Why don't we start back at 1:05? We're going to talk briefly about police violence, and there's a bunch of readings. I think there's one. You know what? We're not, the readings were mostly on gun control, so we'll speak very quickly about police violence, and then we'll talk about gun control and possible intervention. So I'll see you guys at 1:05. So I'm going to dive right back into this and wait for people to join on. We're going to talk about gun control, and I sent you a bunch of articles. I thought the most interesting of the ones was an organization that I'd never even heard of. So I'd heard of the Secret Service, but this was a 70-page article, United States Secret Service National Threat Assessment Center. Do people remember seeing that? I asked you to read the executive summary, which were the Roman numeraled. I thought there were just like ridiculous numbers of pearls in that executive summary. Can anybody share with me what they thought was interesting in the? It's titled They studied from 2016 to 2020. And if you want to pull up the document, Moodle, do it so you can look at it and tell me what you found interesting, because obviously there's lots of materials that I sent you, so you may want to just refresh your memory. But the key implications, and it hit a ton of media places. I mean, everybody covered this article because it was so timely with the mass shootings in California. Not all at once now. Try to keep it down. So, anything from that article, pull it up and tell you. I mean, so I think they studied like 200 something, 257. Hang on, let me just remember. 173 attacks were studied. So most of the attackers had exhibited behavior that elicited concern in family members, friends, neighbors, classmates, coworkers, and others. And those individuals feared for the safety of themselves or others. So any thoughts on preventative measures for dealing with that?
I mean, personally, for like receiving a gun, I think there needs to be more of like a background check, especially like, I think that there should be like a mental health background check. So to ensure about preventing gun violence, but the like the drawback from that would be like people can like, I guess, lie on that background check, and that could like still happen.
Yeah, there's again, this is privacy versus public safety, but has anybody ever heard of red flag laws? Or did you read anything about it? Anybody who read anything about it or knows what their general gist of a red flag law is, let me know. I saw a few people nod. And I would much prefer to hear from people who don't, once you've spoken, please really pause in terms of letting other people speak as well. I mean, I'm delighted to hear from the same person 20 times, but that just means it's the two of us having a conversation as opposed to the class. So the question was red flag laws.
Isn't it like basically if you have like a red flag, you can't get a gun for like a certain amount of time, depending on like the rule of which law it is?
Yeah, so each law is individual, so it's a great point. But the typical designation is somebody is concerned about you being safe. And the red flag laws are, the classic example is, you're in the middle of a divorce. It's very unpleasant. You definitely have firearms. You've said repeatedly, it would be so great if my spouse was killed, whether it be male or female. I don't want to make it misogynistic or misandrist. You go to a judge and you just go, this is incredibly rancorous, and there's been various threats going back and forth and accusations. This person should have their gun, removed. And it doesn't mean they can't get them back, but it just says you can't have it now, and courts will approve that. It's not efficient. It's not particularly easy, but it certainly makes sense, based on the data.
The thing I always had a question about was when somebody like goes to the court and brings this concern up, how long does it take for them to actually approve this, for them to have actually gotten a court, like a court meeting and then to approve it? Is that person like, does it happen that people are in the process of getting, a red flag law pulled up and the person commits a crime?
So what these things like temporary restraining orders, they basically, no pun intended, trump every other case that's in front of them. I mean, if you're being arraigned for murder and you're in jail already, but a woman's afraid of being attacked by a stalker or some obsessed crazy guy, all those get heard almost immediately. And the ruling typically occurs, at the time of the hearing. Yes, there's just cause for issuing a temporary restraining order, and this is the equivalent of a temporary restraining order, because instead of saying, the judge would then say you're not allowed within 200 feet of this person's home, and if you make any contact by email, message, visit to the home, you will be arrested. And literally, they issue that temporary restraining order, and then you can call the police, and the police will come over and arrest that person. So because again, people's lives are at stake, and people die every year because of this, and because temporary restraining orders are ignored, because there's just a lot of lunatics out there. And this would sort of rise to that level of a red flag. So it's not like you're going to have to schedule a court date in 3 months. It's going to be heard, expeditiously, and be ruled on. So because lives are at stake. So, and it totally makes sense. If people have had an opportunity to look at this report by pulling it up, just the 4 pages. Anything else that that caught your eye, or you thought was interesting, or you didn't know, or provides an opportunity based on the information that's collected to do something preventative?
The article said that over half of the attackers had like mental illnesses of some sort before, and so it's like seems like it's more of like a mental health issue rather than like a gun control issue.
So, this is such an interesting topic because I don't know what to do with it, and I'd be curious if you guys do. So you keep hearing that this is a mental health issue. So as far as I'm concerned, anybody who's a mass killer has got something completely, something completely wrong with their psyche, whatever their mental health is. But the statistics actually belie the fact that people with no mental health history are just as likely to commit these heinous acts. So it sort of goes to that same issue of 60% of people who commit suicide have no history of mental health. So using mental health as a screen, clearly, if you have it and you've had suicidal ideation or psychosis or those things, then yeah, then that should be a red flag and might prevent you from gaining a firearm until you've been certified by an appropriate health professional as being able to safely use and operate, and you don't have crazy ideas. I don't think crazy is politically correct, but you know what I'm saying, mental health issues. So if I say something that's politically not correct, just, remind me, send me a note and just say, don't use that term. So I apologize, but mental health issues. So yeah, so background checks are good. Waiting periods are good. What did anybody remember reading anything about workplace violence? We keep hearing about people going postal. Why do they call it going postal? You know where the expression comes from? Have you guys heard the expression going postal? Jeez, I must be dated. Well, so have people ever heard of postal workers murdering their work colleagues and the like? Oh, well, I guess for a period of time it was happening all the time. That there were tons of postal workers going in and killing their colleagues. So that's where the term came from. But I'm going to Google it after class just to make sure I'm not remembering it wrong. But there was just one recently. I'm sure this one you remember, which is the Walmart employee who went in and killed a bunch of fellow employees. That was within the past 3 to 4 months. So do you remember? Does anybody remember what they said about these work environment things? Whether it be domestic or workplace issues.
Didn't it say something about like the person trying to like justify a perceived wrongdoing?
And yeah, these people are also they've got behavioral health issues. I mean, who the hell kills your coworkers when you're unhappy at work? I mean, if I were an HR worker, I would be running for the hills or be wearing body armor based on some of these anecdotes. But the reality is that people with either domestic violence or workplace violence, if you go to them, they will very frequently. And here's the line in the paper. It says half of the attackers were motivated by grievances and were retaliating for perceived wrongs related to personal, domestic, or workplace issues. So it's out there. Now, does that mean everybody who's mad at work shouldn't have a gun? No, what should happen is if there are perceived folks who are are making inappropriate and or dangerous or threatening statements, yeah, they should be reported and they should be evaluated. And those are the people who should have the red flag laws brought into play. Because I think this Walmart guy was a guy who said, I'm going to kill you and you're not doing, you're treating me unfairly. And there's just tons of stuff out there. So, a lot of this data and these responses are hindsight bias or Monday morning quarterbacking. Does somebody want to, and I'll call on you in just a second, Monica. Does anybody want to explain to me why I'm mentioning hindsight bias, or what they think it means, or what Monday morning quarterbacking means? What does people have to have heard of Monday morning quarterbacking? Maybe you're not football fans. Jack, are you going to rescue us here on what Monday morning quarterbacking is? You can say I have no idea. It's fine.
Yeah, I got no idea.
Oh, interesting. So it's just a colloquialism for, it's 4th and 1 and they go for it and they don't get it. And so they lose the ball's turned over on downs. And then people go, oh, of course they should never have gone for it. And then of course the reverse is they go for it, they get it. Oh, that was a brilliant idea. So that's the whole concept of hindsight bias, that you're immediately biased by knowing what the final outcome is. So when you're doing these surveys of people to say, what was there, now this person killed 10 people or 5 people. So, then people sort of go, oh yeah, he or she said, and it's unfortunately usually a he, said this and this and this and this. So a lot of the data is skewed. And do you think that concept of, and that's called hindsight bias, that's the quote unquote scientific term for it. And it happens all the time, for instance, in medical malpractice. Somebody sent a case from a plaintiff's attorney. What do you think, like an expert? So an expert witness is asked to look at a case from a plaintiff's attorney. What do you think they're going into the case looking for? I'll make it easy. So I was a radiologist. I was an expert witness. When I got a case from a defense attorney, they would send me an x-ray and say, what do you think of this x-ray? And the same thing on the plaintiff side. So why are they sending me an x-ray? What do I know in advance of the case?
Maybe it was misdiagnosed or not read correctly. And
exactly, it's a lawsuit. Somebody's looking to see if there's a lawsuit here. So the first thing I'm looking for is what was missed on this x-ray. Do I look at an x-ray, whether it's from the plaintiff side or the defense side, knowing that it's in litigation? So somebody has been injured and they're looking for whether there's a lawsuit here. Am I looking at that as the same way I'm looking at an x-ray in a stack of 100 x-rays that I'm reading during the course of a day? Or do I look at it in a different light?
I mean, it's probably in a little bit more depth because of the stakes of the situation.
I'm inherently biased. I'm getting this case from an attorney. Of course, I'm going to look at it in a completely different way. So what I would actually ask them to do is send me 3 x-rays. One of them was the case and 2 others had nothing to do with it, were, unrelated, so that I could at least minimize my chances of being biased. But hindsight bias is actually well studied and well regarded. And I'll tell you, in terms of being recognized as really tainting data. So I'll tell you one really interesting study that was done. So they pixelated pictures, and they were all pictures of very famous people, Jesus Christ, Muhammad Ali, people who were all easily recognized. So they asked people to guess who the person was. So they would, depixelize, they would show 50 of the pieces of the picture until they recognized the picture. And then they went back and they said, oh yeah, that's Muhammad Ali, that's Jack Kennedy, that's Mahatma Gandhi. And then they went back to them and they said, when do you think, now they've all seen the pictures and they've seen the pixels, and they said, we want you to guess when you recognized who the picture was being taken. So we're talking about hindsight bias. What did people uniformly do? Did they predict completely accurately when they recognize who the picture was? Now remember, they've seen it before. Did they predict later than they needed, or did they predict earlier? Did I explain the study so that you understand what the hell I'm talking about? So I'd say it again, because it made no sense.
Say it again.
Yeah, no problem. So just like this picture we're looking at, so pictures are made of 256 by 256. So if I show you one pixel, you'll have no idea who it is. If I show you half the pixels, you'll probably not know who it is. If I show you 3/4 of them, then you're going to probably get a pretty good idea of what the picture is of, whether it's Michael Jordan or Jesus Christ or Mahatma Gandhi. So, and of course, when I show you 100%, you're going to go, oh, that's a well-recognized, whatever, fill in the blank, sports figure, political figure, famous person. So they showed all these pictures, and they showed them 25% and 50% and 75% of the picture. And they said, and until they recognized it. And then they went back after they had recognized all 12 pictures or 10 and said, tell me when we showed it to you the first time, when you recognized who the person was. Did you recognize it at 25%? Did you recognize it at 50%? Did you recognize it at 75%? Do people understand how the experiment was done now? If I need to explain it one more time, I'm happy to do so, because hindsight bias is really important. So it makes sense what they did? So did people guess that at earlier, like, oh, I recognize that at 50%, or did they say, oh, no, I only recognize that at 90%? Or did they recognize it at the exact same time that they recognized it when they did it the first time?
My guess would be later, like
okay.
90%.
So
sooner.
I'm sorry?
I was thinking sooner.
Yeah, and the reason that sooner makes sense is that's the whole nature of hindsight bias. They're immediately recognizing it because they've seen it before. So they don't need to get to 90% because they recognized it at 70%. So what they tend to do is say, oh, I've seen this before. I recognized it at 50%. So they don't need 90% to recognize it. So they consistently said they recognized it earlier. And then they said, look, there's this. So they then did the experiment a third time. And they said, everybody says that they recognized it earlier than they actually did. So adjusting for the fact that you've seen this before, try to be much more accurate. Like, let's just say for the sake of argument that almost all the pictures were recognized at 75%. That when they looked at them the second time, they said they recognized it at 50% because they'd seen it earlier. But they said, now the third time, we want you to you guessed too early. I want you to guess much later when you really think you did it. So did they then guess, when they were told to guess later because they guessed too early, did they then accurately determine it, or did they still do it too early?
Probably still too early.
Yeah, absolutely. You have good instincts. So you can't ignore the whole, hindsight bias problem, because you're biased already. So it's built into you. We are hardwired as human beings to sort of look at what we already know is the answer and make bad decisions and come to wrong conclusions. So you just have to keep in mind hindsight bias when you're looking at studies like this. So we don't have a whole lot of time left. We probably have like about 10 minutes. And you've read all these materials on gun violence. What are your thoughts about what would be preventative measures in terms of gun violence? The other thing too was that Secret Service paper, that 70-page paper that I had you read the intro to, talked about the fact that a lot of these people go on diatribes and are threatening violence on social media. What would be a very quick way, using AI and or natural language processing or both, to use that to our advantage to prevent mass shootings?
Like monitoring social media posts?
Yeah, I mean, it's so easy to do. I mean, you can just monitor them all, or pass a law and say, Twitter and every other and Facebook all have to monitor their own sites for threats of violence and report them to law. I mean, it's criminal. It's criminal behavior to threaten somebody with violence. I mean, so reporting it to law enforcement is probably the smartest thing we can do. I mean, we're going to keep a lot of people busy because there's a lot of lunatics out there who threaten violence and are racists or hate certain religions or whatever for whatever reason. But I mean, you have to monitor people like that. You just can't take everything as idle threats. Certainly, you know, when they're monitoring any discussions of threats against, you know, the president, all those people get visits from the Secret Service. You know, you can't make threats against the, you know, of elected officials without getting visits from Secret Service. So there are some easy things. Now, should we be focusing our energies on mass shootings and what we can do to prevent mass shootings, or is that the wrong approach when it comes to gun control? So what percentage of deaths associated with handguns are related to mass shootings? We know that's all we see on the news and social media, but in reality, well, let's do this. We'll do the 10, 20, 30. So 10%, 20%, 30%, 40%, less than 2%. I didn't even give you the right option if you voted at 10%. So this is just media frenzy. This is all, if it bleeds, it leads, no pun intended. But, you know, the classic, it's sensational, it's horrific, it gets clicks, it glues people's eyes to the TV. It's not a problem. It's the same question and answer for terrorist threats. We spend hundreds of millions of dollars on security for terrorist threats and the risk of being killed by terrorists. Is it, we'll do the same thing, 10, 20, 30, 40, 50%. You know, as a cause of deaths, are terrorists responsible? Let's make it lower, 5, 10, 15, because it's going to be a relatively low number. So do you think that terrorist deaths are 5% of violent deaths in the country, 10%? Everybody's raising their hand at 5%. Yeah, it doesn't happen. It's like putting shark netting out at every beach in the country. You're not saving any lives. You're spending a lot of money for shark netting, but there's probably 3 or 4 shark deaths a year, maybe 6 or 7 worldwide. Maybe more people die of getting struck by lightning than getting eaten by sharks or dying from a shark attack. So this is a classic problem of public health responding to what gets media attention when it's not the thing that's causing the most deaths or the most harm. Just be painfully aware of that fact as well. So you got hindsight bias, you've got bias associated with what gets the attention. And so you end up with bad decisions. So in the last 5 minutes of class, give me your thoughts about what would be best practices to reduce deaths associated with gun violence. That not necessarily mass shootings, deaths associated with gun violence, with guns. And, you know, plenty of materials that you guys were given to sort of address that issue.
I feel like education at like an earlier age and like mental health screening, but like those screenings are becoming more common. So I feel like we're starting at the right like track, if that makes sense.
Yeah, no, it's true. And what have I always told you about education as a means for changing human behavior? No, you have to do it. You have to do it.
Yeah,
I don't want to dissuade people from ever saying education, because education is always a good idea. The problem is education doesn't work. So you want to present the information, you want to guide people, but when I say education doesn't work, I have to tell you very specifically what kind of education doesn't work, because you're going to go like, hold on, I just spent $200,000 for this education and you're telling me none of it works. No, the kind of education that works is the kind of education that we're doing now. What are we doing now? Am I giving you a PowerPoint presentation and asking you to regurgitate it to me on a quiz in 2 weeks?
Just talking about it and spreading awareness.
Experiential learning really works. So if you're interested in education that works, look up experiential learning or cognitively aware learning. So teaching that creates a surprise in you. You will remember that. Teaching that creates some bit of humor, you'll learn much better. The best teaching is the teaching when I ask you a question and you come up with the solution because you've thought about it, you've analyzed it, and you came up with a solution. You own that solution. That solution becomes firmly embedded instead of me asking you, what was the birth date of Albert Einstein? That's just rote memorization and is essentially useless. So reading our policy and procedure book so that you can, perform safely in a hospital setting is useless. But telling people, here's the problem, I want you to figure out with a patient and how a patient can get harmed. You come up with the solution as how we can keep that patient safe. You're going to own that. That's going to be yours, and you're going to take it with you. So that's the kind of education. So I don't mean to dissuade education. It just has to be the right kind of education. Any other suggestions? Gun violence. Where I tragically, in the next whatever 10 weeks that are left, we will be facing this issue again and again. There will be many more media stories of these tragedies.
I saw this guy who gave this talk, and there was this point that he gave that I liked about how a lot of people's arguments for like needing to register their guns and everything is like, oh my God, like they're taking our guns away. But it's like, we have to register our cars, we have to get a license, like every like other like dangerous activity that we do every day is like insured in some way or registered like to guarantee safety almost. But we don't do that with guns. But it's not like we go into the DMV and they're like, oh my God, they're taking our cars. Like it's
I think that's spot on. Didn't I send you a YouTube on a guy who did, I don't know if it was a TED talk or just a YouTube, who's I trying to remember what, I think he was from Johns Hopkins. He was a world expert on gun control, and he said, I'm not about getting rid of people, taking guns away from people, but we need much more detailed background checks. We need waiting periods. We need this. Did you read that for this class or see that for this class? It was like a 15-minute video.
Yeah, I didn't see it like from something that you sent, you might have, but I just saw it somewhere else on my own.
Yeah, no, which is great.
Okay.
That's fine. Did anybody else did it? Was that, it may be included in a later class? Did anybody else see that YouTube? So a few people saw it. It may have been embedded in my hang on. Yeah, elective resources on gun violence. Let me just see if that comes up. If the YouTube, it's really a great YouTube. It's worth watching at 1.5 speeds because the guy's balanced and reasonable. So there was an article from the New York Times about gun shootings and the data associated with them. No, it's actually not in that document. I may just find it again. You know what? I may have sent it to you in a in one of the course announcements.
It was an email that you sent.
So it was a course announcement. Yeah. So I sent it in a course announcement. If you're interested in gun control, go to the course announcement. Let me just see if I can find it. Yeah, so there are two course announcements that went out, two on the 25th, and I think it's one of those two. Yeah, it says review please on the 25th of January. So if you're interested, fine. If not, and you want to work on your paper, work on your paper. So that's all cool. I think that's it. We've got 4 minutes left. I'll take any questions you guys have. Just remember, please submit all your questions because it's 40% of your grade, and participate in class as much as you can. Because again, that's 15% of your grade. And tomorrow, stay warm, stay inside, turn up the heat. And that'll go through most of Saturday, since it's supposed to be somewhere around 15 below zero without wind chill. With wind chill, 30 to 50 below zero. So stay warm, be safe, don't go skiing as much as you might love it. And we'll talk next week. And again, you know what, I'm always available. So whatever, with emails, we can do Zooms, we can do phone calls, whatever I can do to be a resource for you with your papers, with the questions, whatever. I'm there. Yeah.
Do you mind like providing like a rubric or some type of outline for the paper? Because I am a little confused of like what you, like, I'm not quite sure if it's like a research paper. Like I just need a little more details.
Yeah. So basically all I've asked you to do is choose any topic of your liking and come up with a hypothesis, just sort of scientific method, and a hypothesis of what is a reasonable preventative measure for, for solving the problem that you're looking at. So, and I sent out an email saying, these are the possible solutions. If you can come up with more, go for it. So, and I think that's in a course announcement, but I can resend it out. Yeah, it says choosing topic. Hang on, let me just see. No, that's not the one. Anyway, there's one where I say regulation, legislation, incentives, education, penalties. So whatever tools are available out there to get people to engage in whatever you're trying to get them to engage in as a preventative measure. That's what I've asked. So, typically at the beginning of your paper is, this is the nature of the problem. I mean, nothing, interesting or different or unique. This is the nature of the problem. This is some background on the problem. This is what people are doing about the problem. This is what I'm suggesting. Here are the pros and cons of how that can work in terms of being a preventative measure for the problem.
Perfect. Thank you.
Does that make sense? Is that fair? I mean, I can go into more detail, but I'm just going to say what I told you right here. And this is recorded, so I can send that out to anybody who wants to listen to it again.
No, it makes sense. And I found the announcement, so I'm all set.
Oh, did you find the announcement where I talked about the different?
That's the scheduled brief Zoom meeting or call with me.
Okay, perfect. So people, thank you for doing that, Anissa. That's great. Yeah. So people who want to sort of look at what I'm looking for, it's the announcement that says, please. Geez, you're good. I can't even find the darn thing. Choosing topic. Oh, because a couple of them are labeled PBH332. That may be one of those. If you want to send it to me, then I'll send it out as another announcement so people can have it to reference. I appreciate it.
No problem.
Awesome. Thank you. Okay. Hey, be safe, everybody. And again, any problems, questions, issues, just reach out. I'm here to be a resource and make this good. In 2 weeks, we're going to go over a quick sort of mid-semester, how do we make this class better? I'm actually enjoying our going over current topics and spending 45 minutes or an hour. We go over a lot of very current material and material that's interesting. Hopefully you guys are learning something with those discussions, which are wide ranging, but totally, topical and timely. And then, with the papers, I think those sort of advances just keeps you moving forward on it. And lastly, focusing more on one particular topic, I think has been great. But if you guys disagree or you want to change it and move it more in one direction or another, just let me know.
Perfect.
Yeah.
Thanks for everything, guys.
Thank you.
Be safe, be warm.
Thank you.